Hi, everyone. It looks like it's 2 minutes after 7, so we're just going to go ahead and get started. Thank you, first of all, for joining our virtual information session for the Nursing Unit Assistant Program, and welcome. We'll just flip on over to our agenda here. So I'll just go over the agenda, what this little information session will look like. And so we're going to start out with introducing our panel members. We're going to talk about the rewards of being an NUA. We'll give you an overview of what the program looks like, as well as each individual module. We'll let you know about the rewarding careers that follow and your next steps and questions. At the end, we'll have a little Q&A. So just if we can skip the chat part, and if you have questions, go on to the little bubble that says Q&A instead of the chat, just so that it's a little bit easier to follow for us, so we're not having to go through a few things. So just to introduce us, first of all, my name is Chrissy Roms. I'm a program coordinator out of the Kelowna campus, and I will be one of your hosts for this evening. We also have my colleague, Cindy Meisner, who's also a program coordinator. She is working out of Vernon, and she will be the one in the background monitoring our chat and discussion. Nope, not chat, Q&A. And last but not least, one of our instructors, Dawn Allen. She will be giving you guys the most information about this program, as she's very well versed in this field, has been teaching and doing the job as well. So I am going to turn it over to Dawn and let the expert give you a little information on the program.
Okay, hello everyone. it looks like we'll start with the rewards of a career as a nursing unit assistant. One of the greatest rewards is to be actually in the healthcare system and part of a team, even though you're not hands-on being a nurse. I wanted to be a nurse many, many years ago, but don't have the stomach for it. So you still get to help people and provide care. You still are performing challenging tasks. It's fair benefits and compensation once you are employed and have a position. There is a benefit package that goes with the job. And as I mentioned at the beginning, you are in a great team environment. So you're part of a team, and that is with other nurses, with physicians and surgeons, care aides, and many, many more actually. So you do need to be a good team player to make a good nursing unit assistant.
And Dawn, this the NUAs, they're part of a union, right?
They are part of the Hospital Employment Union, yes, HEU. So I have to. Cindy, can I close my chat screen and you will monitor that? Is that correct? The Q&A, sorry, the Q&A.
Yeah, you can go ahead and do that.
Perfect.
You don't have to worry about that.
Okay. Sorry, were you going to continue, Chrissy, from here?
Yeah, maybe I'll take over this little piece here. So the program is scheduled in 3 different locations. It's scheduled out of the Kelowna campus, the Vernon campus, and the Penticton campus. We each start at the beginning of September, and you start with doing all of your theory classes. As you successfully complete those, you go into your practicum for 125 hours until roughly May 2023. It depends on your schedule is when you'll end, but those are generally the dates. The tuition, approximately $5,664, and there will be some texts and materials on top of that. Most of our materials are on the online classroom, so they're provided for you. So that's nice because it keeps your textbook and your material fee just a little bit down because we provide the information for you, so you don't have to buy a lot of textbooks. We run this program 2 evenings per week, and it is online synchronous. So what that means is you are actually doing, we try and keep the program as face-to-face as we can. So your live instruction with your instructor and classmates over an online platform. Each instructor uses different things. So, and so if you're attending in Vernon or Penticton, after your first module, you will come to, you'll be face-to-face for Saturdays. I don't know why that was so hard for me to say. So the 2 evenings, you'll be synchronous online, and then the Saturdays, you'll be face-to-face. If you're attending at the Kelowna campus, then you will be, you don't start your face-to-face until January. And again, that's just on Saturdays. Your practicum is 125 hours. So it is unfortunately unpaid, but very rewarding. And from mid-April to June approximately. Yeah, we'll go over a little bit more about the practicum later, but I'll let Dawn take over again on each of the modules.
So the medical terminology, the first module, 101, you might have to help me out here, Cindy. This is the nursing unit assistants and the medical office assistants do this together, is that correct? And then both courses go their separate ways?
No. So we used to do it like that, but now what we do is sometimes all campuses are all taking the medical terminology together, but
So
it's all just NUAs now, yeah.
Okay, gotcha. So the 101 is the medical terminology, And this is all online. Is this Tuesdays and Saturdays, Monday and Wednesday and Saturday as well online?
Yes, so depending on which campus you're at, Kelowna's Tuesday, Thursday, and the other campuses, Vernon and Penticton, are Monday, Wednesday.
And Wednesday,
yes.
yeah.
Okay. And then
So
they're both Saturdays.
Saturdays, okay, perfect. So it's a 72-hour course designed to provide level entry proficiency. So what you'll be doing is learning some medical terminology in terms of how to pronounce it, as well as what the terminology means, and often an abbreviation for that as well. So it's the words and the meanings and the abbreviations that are specific to MOAs. It covers lots of human anatomy, the major body systems, and students will learn the basic structure, prefixes and suffixes and terms pertaining to the body as a whole, as well as their related systems. At this point, you don't get too much into anything other than just the basics there. So there's 24 classes. And this is where there is a textbook, I believe. There's not the curriculum online. There is a big chunky textbook. And I believe it's on the screen now, The Language of Medicine. And do the students buy that textbook through the college?
Yeah, absolutely. You can order it through our campus bookstore online. You can go and pick it up from each of the campus bookstores. And or you're welcome to find it anywhere else you like. If you find it somewhere cheaper, if you find it used from a previous student, then you're welcome to buy it. Just make sure that it's the exact edition that everybody else is using.
Perfect. I believe it has a CD with it as well. If you get the if you get it from somebody else, hopefully they'll slide the CD in with it, and that will help you with the pronunciation, because some of the words are not easy to pronounce, and it's nice to hear them rather than just to see them.
Oh, that's a good point, Dawn. Yeah, for sure.
Yeah. So our first module, 101, is communication, and this is a really solid communication course. So it goes through not just some good communication for us to know individually, but also we talk about the communication systems within the hospital, and some of the, not just verbal communication, but some of the signs and some of the symbols that we use to communicate with each other within the healthcare system. It also we talk quite a bit about communicating with other healthcare staff, with patients, with actually one of the most challenging is visitors, and then a whole range of other people that you would communicate with during, for instance, emergency situations. So module 110 is the patient chart records. So we go through the skills and the knowledge that we need. It sounds really easy, but the patient charts are divided into different sections. So we need to know what all the different forms are and where they go, in which section of the patient's chart they go, and what we do with them either before or after we put them there. This is where the Saturday classes start to be invaluable, because we actually have those, each of those forms, and we practice putting them together. We practice what we do with them and taking them apart again. We also look at the ethics regarding confidentiality once we start to have our hands on patient information. This is 5 classes. NUA 120, we talk about admissions, transfers, and discharges. So again, we are in the classroom on a Saturday, and we start to look at our role as the NUA with a patient who is newly admitted to the hospital, patients who are transferred either to another unit of the hospital or transferred to another facility, which could be another hospital, it could be a long-term care facility, or something like a hospice. the learners will process admissions, transfers, and discharges. And at this point, we learn just a little bit about the difference between elective and emergency admissions, and we do some more later on as well. And we start talking about basic diet orders for patients. Oh, then it starts getting tough. In NUA 130, we start pharmacology. So this course will provide you with the pharmaceutical knowledge that you will need as a nursing unit assistant to, first of all, we start with the vocabulary in 130. So we need to know the different types of drugs by their trade name and their generic name, and then the category that they fall into. So this actually is a tough module. So it's definitely one that you want to have some extra time to put into this. We also talk about different ways that drugs are administered to the patients. I think somewhere there's a calendar of when the different modules fall, but I think that's towards the end. So in module 140, we continue with the pharmacology orders, and we learn how we process the orders that the physicians write in terms of the medications. So we practice transcribing and processing medication orders and identify the different forms that we use to do this, because then that is where the nurses and other healthcare professionals will give the patients the medication. So we are processing those medication orders that we just learned about in 130. And this is 10 classes in this section. So in 150, we start to learn about the lab orders. So all of the patients have many lab tests ordered on admission, and then throughout their admission to help to aid in the diagnosis and the treatment. So in this section, we learn the principles and the procedures to process those physicians' lab orders. It says the common lab tests, but it is, even just learning the common ones, it is quite involved. Learners will practice specific communication skills to ensure that they have the complete information regarding the tests with the relevant departments. So there's actually 5 different departments in the lab, and we go through each of those departments and what lab tests they perform and how we process those, and then get the results back to the patient's chart when they're completed. So again, that is a pretty involved module as well. 160. So this is where we process diagnostic orders. So we learn about the different departments in diagnostic imaging. So not just our X-rays, our CTs, our MRIs, ultrasounds, all those different tests that are done in the diagnostic imaging department. So the course provides us information on processing, again, some of the most common orders, how we work, again, with various departments within the imaging department, and how we actually transport the patients to those tests once they are booked. We will develop skills for assisting with the preparation for those tests and communicating diagnostic orders with the appropriate techs or departments, because for some of these tests, there's actually prep, there's sometimes the patient has to fast, sometimes they might need an IV, sometimes they might need meds that are timed with the time of the exam. So we're coordinating getting the patient to the right place at the right time and with the right prep for those tests. Then finally, we move on to 170. 170 actually has quite a bit thrown into it. It is the final course, and it provides information about the types of nutritional needs that patients have and the support that they need. We talk again about admissions, but we go into a little bit more detail in this module about patients who are admitted for surgery. We also talk about post-op orders, so after the patients come back from the operating room, and we talk a little bit more about the different chart forms and preparing the chart for the patients who are having surgery. So we go into a bit more detail here than we did in the basic admission right at the beginning. So this is where we get to practice processing these interventional orders, and we pull everything together, and within those we are continuing to practice our medication orders, our lab orders, and our diagnostic imaging orders. So by this time we have all the information to process all of the orders that will come across our desk.
And Dawn, we just have a question here. Are all the charts done on a computer system?
So the patient actually has a physical chart, and it has sections in it with little dividers. There is still quite a bit of paper charting. There is also a computer system that we learn as with each module, we learn how to use the patient's chart that is computerized, and that's a system that we call Meditech. So we're doing both at the same time. We're working with the paper chart and with their electronic chart. So we would go into Meditech, for instance, and enter lab tests for a patient. The lab results will print off on the printer. So the paper lab results will end up going into the patient's physical chart, as well as being in Meditech. So there's actually both.
Great. And there was one more question for the dress code for Practicum. I think Cindy's answering that right now, but you're welcome to expand on that.
The dress code for Practicum is actually scrubs and I don't know the word but work shoes. So you need closed toe solid shoes. There's no sandals, no flip-flops, no high heels, but the work shoes.
Okay. And does the hospital provide the scrubs normally?
There are scrubs at the hospital that are available. The problem that we're running into now is that there's a locker room that there are scrubs available in, but you actually need a Chubb card to get into that locker room. So it is probably advisable that you have some scrubs for yourself that you wear to work and take home and launder. Once you're employed and you have access to get into the basement, into some of the other areas that you wouldn't have access to as a student, there are scrubs there that you can use. The hospital scrubs are pretty dull though. It's nice. I like to have a few flowers, a few butterflies, some different colors. The hospital scrubs are plain minty green, and nobody presses them. They're just all scrunched up for you. But you know,
especially
the
beauty
beauty
if you
of
can't wear your high heels, right? You may as well get fun scrubs.
Yeah, you might as well have fun scrubs. The good thing is, if anything happened at work, if you say spilt even coffee on yourself, you can get some extra scrubs. But typically I wear my own scrubs. Most people do, unless you are working in the operating room, then you go to work in your own clothes, you change into OR scrubs, and then you change before you leave. But other than that, people typically tend to wear their own fun scrubs.
And Cindy just mentioned to me that if you're attending at the Vernon campus, scrubs are required for Saturdays. So
that's correct. And in Penticton, we had a conversation about it, and there were a couple of people who were already working in the healthcare system and wore scrubs. And so we didn't do that in Penticton, but it got people into the routine of wearing scrubs and what was a good dress code. But in Penticton, when they were already wearing scrubs at work all day, we decided we'd just wear, everyone knew what they could wear. So next year, who knows, but we will have that discussion in the classroom and see what the majority would like.
Okay, and Kelowna, I don't know. I've never, I don't know the answer to that. So, okay, we'll get to, I see that there's a question from Veronica that we're going to address a little bit later. So we'll let you, we'll just pin that for a second and let you continue on with the practicum. And then we'll go back to that.
Okay, so the practicum, and actually it's the practicum started here in Penticton yesterday. So all the students are out there sprinkled around the hospital doing their 125 hours. The practicum is supervised. And so everybody, when they go to their specific floors, do work with a preceptor who is with them all the time. Here in Penticton, I check in every day. I spent, I think, 3 hours at the hospital today. I like to meet people on the floor and see what they're doing. And I also like to meet them in private and see how it's going. And I just kind of float around the hospital for the afternoon, checking in that everybody's doing okay. And it's also time to solidify that learning. There's every day there's extra questions of the orders that they're processing. So it is an opportunity to integrate the theory from all of the modules now into practice. I only can speak to Penticton, and that's how we do it in Penticton. I know Kelowna and Vernon, I'm sure it's 125 hours. I don't know. I'm sure they must be assigned to somebody as well. But during your practicum, you typically get to go to 2 different floors. And we have lots of conversation about this ahead of time, whether people want to are interested in a medical floor, if they're interested in going to the maternity floor. So everybody gets to try 2 different places as part of that 125 hours. It is hands-on, and it helps you, like we said, to just pull everything together and understand the job, understand and put into practice all the knowledge that you have learned now in the healthcare setting. It isn't mentioned anywhere else in the slideshow, I don't think, but the students also do a shadow day. So I believe it was February. I don't know if that was the same in Vernon, but the students actually go to the hospital for a day and they just shadow somebody. You're not expected to process orders. You're not expected to do any of the job, but you get to see the job. You get to see how things are, see how things work, because once you start doing things like putting the chart together, doing admissions, discharges, it just really helps for you to see how this works before you get to practicum. So everyone's kind of had a glimpse into the job before they get to practicum. So lots of the things that we talk about, you've actually seen as we're talking about them.
That's great. Yeah, I know at the other campuses as well, we have the shadow day.
The shadow day, I thought so, yeah.
I can't guarantee that in Kelowna, I can't speak for Vernon, but in Kelowna, it depends on how many preceptors we can get. We have a few more students here in Kelowna, so we don't guarantee 2 spots, but we definitely guarantee 1.
Oh, okay, okay.
So I think she tries to place them where students want to be, but it's really dependent on a lot of different factors.
Okay, so with the 2 spots, what happens is for the first 60 hours, everybody works on one floor, and then everybody kind of switches around. So it's the same amount of students, they just do 2 different places.
All right, Wonderful.
I'll continue with this one. So
Okay.
the employment opportunities. So throughout the hospital, there are opportunities for nursing unit assistants on the acute care floors, as well as in many clinic settings. They use the NUAs as well. So in the maternity clinic, the oncology clinic, the day procedure clinics, the daycare surgery, there is one in the operating room. In Vernon, I believe there's one in the recovery room, which we don't have in Penticton. So there are many different opportunities throughout the hospital, as well as the public health settings, so clinics, those kind of things, which I'm not actually as familiar with. I've always worked in acute care. I started off in emergency, and then I went casual for a little while and floated all of the different floors and landed on surgical. So surgical has been where I have been for probably a little bit more than 12 years now. It is very fast paced. It's the thing I like about surgical is most often there's a happy ending. People come in, they get their surgery, they have, 3-4 days and they go home happy. It is a very rewarding setting, even though it is super, super, super busy. There's 5 operating rooms running Monday to Friday. So the turnover is quite huge on the surgical floor. Lots of surgeries are day surgeries and the patients go home, but I'm on the inpatient unit where they stay for a few days after the surgery. But it's nice to kind of look around and see what all the different positions are. And that's the beauty of being casual. You get to go and check out all these different jobs and then decide what it is that you like.
That's great, Dawn. Thank you.
Mm-hmm.
And I did a quick look, and there's sure a lot of jobs posted too. I know even most of our students will get hired. If you perform well in the practicum, most of our students will get hired. Even sometimes they want to hire them before they're even done. But
actually, one of the students from Vernon has already got a job, been offered a job. So yes, yeah. And you're absolutely right. Everybody that wants a job who is, like you say, has a positive practicum experience, and of course does well throughout the course, there will be jobs. There are jobs where actually my manager has been asking me a few times, are they ready yet? Are they ready yet?
Yes, I think that's definitely a common theme right now for sure. So we're going to pause here for a quick second, and we're going to throw another poll up just because we want to see where you're all from. So if you want to go ahead and answer that. Okay. Okay, so most are from Vernon. There's a couple there's Kamloops, there's Kelowna, there's other, that's mysterious. Wonderful.
What's other?
I don't know what other is.
Maybe
right.
people who haven't enrolled yet. Who are
let me just take a peek at these questions here. The requirements we're going to go over. So we have a question from Andrea. Do you find a casual position offers enough hours?
Oh my goodness. So I have a part-time position just because it works well with teaching. I get multiple texts every day to go to work. I get texts, would I like to work the day? Would I like to work the evening? Would I like to work the night? Would I like to work on surgical? Would I like to work on in the emergency department? So I could work 3 times a day every day.
And you can build up seniority hours, right? At any of the interior health hospitals? Does it work like that, Dawn?
That's correct. So you have kind of one pot of seniority that you are building as you work. Some people have worked in 2 sites. So if you worked, for instance, in Penticton and Kelowna, you build one pot of seniority. If you work in Penticton and Oliver, it's still one pot. So then when positions are posted, they are awarded based on seniority. I mean, it does get more complicated than that if you wanted to move outside of the area, and you can port your seniority even from one health authority to another. You can't continue to build two pots in 2 different health authorities, but yes, you're basically, any hours that you work go towards your one pool of seniority.
Great. All right. Do the hospitals accommodate for needs where you may need to sit more often or may need a more comfortable support when sitting?
I think that to some degree, I know that there have been chairs ordered for people that have specific needs for back support. I know that some people have desks that they can, the ones that you can move up high, and so you could stand. So I don't specifically know because I have not been through that process, but I know that other people have been accommodated, and it's not my business, so I don't know the details of it, but I know that there are different things that I see that accommodate different people. And actually someone has a chair with something for their back, and I sit in it, and it is the most uncomfortable chair for me. So I don't use it, but I know that there are different needs that are accommodated. Yes.
Okay. And will the hospitals hire students while they are in the program?
Mm. The hospital will hire people while they're in the program, but not as a nursing unit assistant. Once you have completed the first module, the medical terminology, people can be hired. And I know this year I had a couple of people that were either in housekeeping, in staffing, in admitting. There's quite a few positions that you're eligible to apply for once you've done that. It says MOA, but it's the medical terminology section. And I believe that does have a separate, correct me if I'm wrong, Cindy, but that has a little certificate once you've done that first module. So you could apply and start working at the hospital with that, but not as a nursing unit assistant until you are finished your practicum. You could be offered a position, but you can't actually begin to do the nursing unit assistant until your practicum is complete.
Right, because you don't have the qualifications.
You would not be able to complete all of the tasks successfully, but you certainly could in other areas. There's lots of booking clerks, admission clerks, and even different departments. People are hired maybe as a porter, in housekeeping. So there are opportunities.
Great. Okay, maybe we will, okay. Andrea, is the MOA section similar to PNR 113? We're going to see if Cindy in the background can answer that for right now, or just come back to that one.
I didn't hear what it was. Is it similar to what? Sorry, what was the question?
PNR 113, it's another one of OC's, it's a intro to nursing, I believe, but I think that one needs a little bit more digging into. So in other words, I can't answer that right now. Okay, maybe we will move on and then get through these slides, and then we'll kind of open it up to like a Q&A. All right, so next steps, it sounds like most of you have applied already. But if you do go to the main webpage for Okanagan College, so www.okanagancollege.bc.ca, Okanagan, wait, oh my God, this is embarrassing, okanagan.bc.ca, then you can, there's a apply, a big red apply as you scroll down to the middle of the screen there, and you can choose your program. So when you are applying, choose the program that's, or choose the campus that's close to you, or where you want to do your practicum. Keep in mind that if you are in Vernon or Penticton, that you will have to go in for Saturdays earlier than you do in Kelowna. Kelowna, you don't start the Saturdays until January, but you always want to pick it where, because that will determine where your practicum will end up, is which campus you picked. If you are from our other or our Kamloops folks, you can please apply to the Vernon campus, and then we can sort that out for you, get you a practicum site at a varying campus. And admission requirements. So to apply to the program, you need your high school graduation or be out of school for a year, minimum of 19 years of age. So either or. You need your grade 12 English with a minimum of 60%. If you are not, if you've done your English in, say, a different province, or you did it like 100 years ago like me and you're not sure what is equivalent, the website is very good at breaking down by province or what that looks like, what's equivalent to an English 12, and then the 60%. You need a negative TB test, and you need a criminal record check. So when you apply to the program, maybe don't go and get all of this stuff at once. Apply to the program, get your transcripts in, your educational requirements, and then let the registrar's office or the admissions office sort of guide you through, because often people apply for there's more than one criminal record check you can apply for. So we don't want you getting the wrong one. The reg office will send you a direct link. They'll tell you specific instructions on how to do it. They'll tell you when your TB results are required. They'll kind of walk you through. So, you know, if we just do it that way, so that if for some reason you don't meet the educational requirements, we just don't want you to spend a bunch of money getting all the other stuff. Not a bunch of money, but a little bit of money, because everything costs money. So once you have been accepted, they will ask for a $200 non-refundable deposit, and then some payments towards the tuition. So there will be, so as I mentioned before, the course tuition is just over $5,600. So they will ask for the full tuition due mid-August. There is an option, I know, to break up your payments, so that you're paying some in August and you're paying the remainder, I think it's mid-December. It just helps it a little bit easier on the pocket if you are paying for it by yourself. And just to mention also, we do have a financial aid website. This program is part-time, so I'm not sure that it qualifies for financial aid, but maybe just, it might be worth just checking out any sort of scholarships or bursaries or something that are floating around on that page, something that you might qualify for. Maybe it'll be nothing because it's part-time, but who knows, right? Extra free money is always good. And this is the contact information for the Vernon and Kelowna and Penticton campus. So you can always use just the regular, if you can't remember the the email addresses or the contact information, no worries, just send an email to the generic campus email, and it'll get filtered through one of us that can answer your question appropriately. So I'm just going to go back for a quick second because there was a question from Veronica. Do I need to be have good typing and grammar skills? Yes and yes. This program is it's heavy, it's hard, it's a challenging program for sure. English is important, communication. I mean, the hospitals, you can't have enough communication. It is super important. And typing, so just to back up a little bit, computer literacy is also important because you are doing the program online. You're using online systems as well. So we do obviously teach you what you need to know computer program wise, but it's really helpful and important that you are comfortable with a computer. And also typing. So while we used to ask for the typing speed to be 50 words a minute prior to getting into the program, but we've since changed that. So you don't need it to get in, but you do need to get up to 50 words before you can go into your practicum. It's really important. And you can't get hired from interior health, or actually I think most health regions, it might vary a little bit by words per minute, but you don't qualify for the job if you don't have the 50 words per minute. So while you don't need it to get in, you will, I think some of the campuses, they practice every Saturday, they do some typing that way, but it is really important that you build your speed up by the time practicum starts.
We do some typing time every Saturday in class, but it's not enough time to get you to 50 words a minute if you're not there. So it's super important to have that. And I would encourage people to have more, because I don't know about anybody else, but I can type 60 words a minute. But if you give me a typing test, I can maybe hit 30. So it does. Taking a test makes you nervous. Taking a test that is going to determine your employment would make you doubly nervous. So your typing is really important. And in the Meditech system that we use, you will need to type all the time.
Mm-hmm. So we will give you a system that we recommend for typing speed and that sort of thing, and we'll sort of guide you through, and instructors will push and nudge and nag for you to be practicing. But it is something that's not part of the program, so you do have to be prepared to practice on your own. We have another question. What happens? So I'm going to take this one, and then I'm going to stop sharing this screen, and I can see you because right now I can only see us. And so, and then we can unmute and have conversations and do a Q&A that way. But there's a question, what happens if you miss a class? You're out. Fail, automatic. No, we understand that things come up. Missing a class can be, you miss a lot of information. The classes are 3 hours long, and that's a lot of information that you're getting. So it's not only textbook information that you're missing, but you're also missing the whole interaction, the questions that maybe don't come up, the off-topic things that come up from the instructor. You know, it's not great to miss a class, and also the classes the attendance is part of your grade as well, because it is really important. So if you do have to miss a class, then you have to miss a class, and it is what it is. You'll have to, usually most instructors will ask that you connect with one of your classmates to get the information, because yeah, it's sort of just the way it works. Yeah. So
it's actually really hard to make up if you miss a Saturday class, because in the classroom time is where you will put a chart together again. You start to process some orders. You take the chart apart. There's different forms that we use, like the Cardex and the MAR, that we practice all these skills together. So if you miss an online class, there's often an easy way to catch up. There's some reading, there's some, you can do your homework, you can catch that up easily. But if you miss processing physician's orders, and in Penticton, I do use real orders that I have been processing that week. And that's what we do. So it's really hard to catch up if you miss a Saturday class.
Yeah, and that's a good point too, is the Saturday classes are 6 hours long.
Yeah.
So that is a big chunk.
It is. And I don't know, the students always say the Saturday class is the most valuable. They can read a PowerPoint, they can make their little study guides, they can study by themselves. But, you know, a student said to me today, because I take in orders and we practice orders that are written in Penticton by Penticton doctors. And the student said to me today, oh, I finally met the doctor whose orders that I've been processing for all this year. And she'd met him and she recognized his writing and said, oh, that's Dr. Paisley. I know from the writing. So these aren't, when we're processing orders in the classroom, it isn't just curriculum. It isn't just something that the teacher made up. These are real orders written by the doctors. All the patient information is gone. We take the patient information away, but you're actually kind of doing what you will be doing in the job on Saturday. And obviously we start those orders based on what you know, and we build on those skills, and we work through orders that get more and more complicated. We don't practice lab orders until we get to that section, but when we do, they're orders that are written at your specific hospital by those doctors. And you just get used to seeing different doctors' handwriting, because I have to tell you, that's one of the biggest challenges to this job, is reading the doctor's handwriting. But you do get used to it, and you see it in class, so it's not such a struggle when you get to the hospital. You're like, oh, I know Dr. Paisley because I've done his orders before. So it's invaluable to be in the classroom on a Saturday.
So if anybody has a question, you can hit the raise your hand. You can just even unmute and ask questions too. That's yeah, I would love to hear a voice. Okay. We have no hands. Okay. Well, if we don't have any more questions, I want to truly thank you for all the questions that people did ask. It's nice to have that. There's so many things that we don't go over and we don't have time for, so it's nice to kind of veer off and answer those specific questions for you. If you were a little bit shy today and you didn't want to ask your question through here, then please contact our office and departments, and then we can answer any more questions that you might have. I think that you've chosen, should you choose, a really great, rewarding, important career. So I think that you'll get a lot out of the program. I think that you'll get a lot out of the job, and yeah, I don't think you can go wrong with the NUA certificate.
Mm-hmm.
That's for sure. It's one of those short programs that is gets you right out of school and right into work in a short amount of time. So yeah. So thank you all for taking your time tonight and joining us, and appreciate it, and all the questions. And thank you, Dawn and Cindy, for your help with this.
Mm-hmm. Thank you.
All right. Oh, wait. Do we have Andrea who raised a hand? Do you want to unmute, Andrea? Okay, maybe that was just a mistake. Okay, well, we'll let you all go. And again, thank you and have a good night.
Thanks. Bye-bye.